Assalamu alaikum. I am Dr. Moushumi Taher Asha, Associate Professor, Department of Anatomy, Boshundhara Ad-Din Medical College. Students, today I am going to discuss about the cranial nerves. First we want to know how many cranial nerves present in our body. There are 12 pairs of cranial nerve present in our body. When these 12 pairs of cranial nerve leaves the brain and passes through the foramina and fissures in the skull and supplies the whole of the body. All the nerves are distributed in the head and neck region except 10th cranial nerve, which also supplies structure in the thorax and abdomen. What are the names of the cranial nerve? This is very important for first year and second year students and for professional viva. And what are the names of the cranial nerves? Number 1 is the olfactory, then optic nerve, oculomotor, trochlear, trigeminal, abducent, facial, vestibulocochlear, glossopharyngeal, vagus, accessory and hypoglossal cranial nerves. There are some functional component needs to the distribution of the cranial nerves. What are the functional component present within the cranial nerves? There are some efferent fiber and there are some efferent fiber. Within the efferent fiber there is a 4 functional components, that is general somatic efferent. It means it takes general sensation. Then spatial somatic efferent. Spatial somatic efferent includes hearing, balance and vision. General visceral efferent, which means sensation carried from the viscera. Spatial visceral efferent. Spatial sensation is smell and the taste. And there are some efferent fibers. Efferent fibers are general somatic efferent, general visceral efferent. It gives supply to the gland and smooth muscle, and general somatic efferent gives supply to the somatic striated muscle, that means the skeletal muscle. And the spatial visceral efferent is the branchial arch striated muscle, which are derived from the pharyngeal arches, which is supplied by the, or which is the functional component is the spatial visceral efferent. Now we are going to discuss of the each of the cranial nerves. First of all is the olfactory nerve. Olfactory nerve comes from the telencephalon. Telencephalon is the forebrain. Within the telencephalon there is a cerebral hemisphere. Cerebral hemisphere. These olfactory nerve are enclosed by meninges. It presents with the subarachnoid space. There are first order neuron, third or second order neuron and third order neuron throughout the pathway of the any sensation from the periphery to the center. There is a 3 order neuron present, but within the olfactory nerve there is only first order and second order neuron present, no third order neuron present. All of the sensation going to the brain, the third order neuron is the thalamus, but in case of olfactory nerve no third order neuron present. This olfactory nerve is the sensory and its neuron is the bipolar neuron. Bipolar neuron, this is very important. Olfactory nerve directly contact with the surface, it is contract with the surface, and neuroepithelium which is ectodermal, neuroepithelium which is ectodermal. The functional component of the olfactory nerve is the spatial visceral efferent. Spatial visceral efferent, that means it carries smell sensation, and it passes through the cibriform plate of the ethmoid bone at the base of the skull. It passes through the cibriform plate of the ethmoid bone at the base of the skull. There is a lots of opening within present within the cibriform plate. There is a rootlets of the olfactory nerve passes through it. These are the pictures of the olfactory nerve, formation of the olfactory nerve. This is olfactory bulb, olfactory tract, and here is the cibriform plate of the ethmoid bone through passes the olfactory nerve, and this is the pathway of the olfactory pathway. I will discuss it later. If there is any pathology or any inflammation or any injury present within the olfactory nerve, the lesion is known as unilateral anosmia and the bilateral anosmia. Second cranial nerve is the optic nerve. The fibers of the optic nerve are the axons of the cells in the ganglionic layer of the retina. We already know retina has 10 layers. From the ganglionated cell layer, optic nerve arises. The functional component of the optic nerve is the spatial somatic afferent, and the function is the vision. So, very important, and it passes through the optic canal. It passes through the optic canal. This is the picture of the visual reflexes, and this is the figure of the visual body reflex and corneal reflex. I will discuss it later. Then third cranial nerve is the oculomotor nerve. The oculomotor nerve has few nuclei. The main oculomotor nucleus. Accessory parasympathetic nuclei is known as Edinger-Westphal nucleus, and the functional component of the oculomotor nerve is the motor function, that is the general somatic efferent and general visceral efferent. General somatic and the visceral efferent, this is the solely motor nerve. The function of the oculomotor nerve is the raises the upper eyelid, turns the eyeball upside, downwards and medially. It constricts the pupil, accommodates eye, opening through, it passes through the opening of the superior orbital fissure. Superior orbital fissure. This is the figure showing the nucleus of the oculomotor nerve. There is a Edinger-Westphal nucleus, main oculomotor nucleus, and this is the oculomotor nerve. When there is a lesion occur within the oculomotor nerve, in complete lesion of the oculomotor nerve, the eye cannot be moved upwards, downwards or inwards. At rest, the eye looks laterally and downwards. Diplopia, that is the double vision. Ptosis, the pupil is widely dilated and non-reactive to light. Accommodation of the eye is paralyzed, that and internal ophthalmoplegia and external ophthalmoplegia. These are the lesions of the oculomotor nerve. Now, fourth cranial nerve is the trochlear nerve. The trochlear nerve is entirely motor nerve. The functional component of the trochlear nerve is the general somatic efferent. It assists in turning eyeball downwards and laterally. It passes through the superior orbital fissure at the base of the skull, and lesion occur within the trochlear nerve is the double vision. This is the figure of the oculomotor nerve. This is the trochlear nerve, and it comes from the this way, that is the oculomotor nerve. Then fifth cranial nerve is the trigeminal nerve. The trigeminal nerve is the largest cranial nerve, contain both motor and sensory fibers. Trigeminal nerve nuclei are the main sensory nucleus, spinal nucleus, mesencephalic nucleus and the motor nucleus. The functional component of the trigeminal nerve, we already know the trigeminal nerve has three divisions: ophthalmic, maxillary and the mandibular division. The ophthalmic and maxillary is the sensory and the mandibular is the mixed part. That means it includes sensory and the motor fiber. Ophthalmic division, general somatic afferent, that means sensory, general somatic afferent. The function of the ophthalmic division of the trigeminal nerves are cornea, skin of the forehead, scalp, eyelid, nose, mucous membrane of the nose, maxillary sinus and nasal cavity. It carries general somatic afferent sensation and opening through the superior orbital fissure. And maxillary division is the general somatic afferent. It carries sensation from the skin of the face over the maxilla, teeth of the upper jaw, mucous membrane of the nose, maxillary sinus and the palate. It passes through the foramen rotundum. So, students, this is all for today. Thank you very much.